Hello, I'm Mariah and welcome to Facts with Franks, an educational series where we talk about various things that rat humans want to know. And today we're going to be talking all about things related to rats and the vet. Disclaimer, I am the president and founder of Frankie's World Rescue in Ontario, Canada. I spend a lot of my life with rats, and my other job is as a doctor. I do work in family medicine, emergency medicine, inpatient hospital care, and palliative care. This means that I understand medical conditions pretty well, and it helps me a great deal when taking care of the ratties. All the information that I present in these educational videos comes from my own medical knowledge, mixed with trusted veterinary advice from the amazing vets that we're able to work with, as well as my personal experience and opinions. These videos aren't intended to be used as medical advice. We encourage you to always consult your veterinarian with anything concerning your rat's health, but the info that we do share can be used to help guide you. Taking your rat to the vet. Owning a pet is a privilege, not a right. You choose to bring them into your life and they depend on you to do what's best for them, and that includes vet care. First of all, yes, you do need to take your rat to the vet if they need it. Don't bother thinking about adopting an animal of any kind unless you're prepared to take them to the vet if and when they need it. There's no, but it's just a rat, or they're so small, or they only live 2 years, so what's the point? The size and lifespan of a creature does not determine whether they are deserving of health care or not. The simple fact that they are sentient beings is the only reason they need. Period. Vet care comes with associated costs, so you need to be prepared for that as well. Far too often we have people contacting us saying, "Help, this is going on and I can't afford to take my rat to the vet." It's not okay. They should not suffer because of poor planning. If you're not prepared to possibly spend a couple $100s at a time on your rat, then don't adopt one. If something truly extraordinarily unexpected does happen and you adopt an animal and you end up losing a lot of money and really don't have much to spare, there are organizations that can help with that. In our area, for example, there is the Farley Foundation. Some vets will also let you do a payment plan so you don't have to pay all at once. Basically what I'm getting at is whatever the situation, there's a way to make it work if you want it to. So you need to care enough and be motivated enough to find a solution rather than just remaining helpless and saying that taking them to the vet is not an option. Do your rats need annual health checks? It depends. If you're an experienced rat human and you know your rats well, know what signs to look for and what various conditions look like that would warrant medical attention, then I say no. They don't need vaccines, and it's fairly easy to learn how to do a health check on your rat to screen for anything worrisome. We only bring our rats in when we have concerns because we do basic health checks on our rats pretty much daily when we're interacting with them, and it would be far too cost prohibitive and, in our opinions, a waste of resources to take every single rat to the vet for an intake exam and an annual exam. We choose to save those funds for emergencies, surgeries, or other critical needs. This is our approach because we find it's the best use of resources and still gives rats the best care. On the other hand, if you're a first-time rat human and you want to touch base with a vet and it gives you peace of mind to have them checked over every once in a while, then totally go for it. Finding a vet. Here's where things get tricky. Rats are considered exotic species in the vet world, so not every regular cat and dog vet will see rats. Some will, if they have experience, but most will not. You need to search for a vet who sees exotic species. Sometimes they're advertised as such, and sometimes they are not. So sometimes you might have to do some digging and phone calling. So let's say you've found a couple that say they'll see rats. Now, how do you choose? This is also where things get tricky. Not all vets who say that they will see rats are created equally. Some have basic knowledge of the basic common conditions in rats, such as respiratory infections and mammary tumors, and others have a knowledge base more akin to an exotic specialist who did residency training specifically in exotic medicine. That being said, you also don't need to go to a specialty clinic that only sees exotics to get proper care for your rats. We've had plenty of suboptimal experiences and, quite frankly, unacceptably poor care from emergency exotics clinics, and fantastic care from our regular vets who also see exotics. So don't let the pretty shiny things fool you. You can, use your own judgment and ask others about their experiences if you can find others in your area who have taken their rats to that clinic. Chat groups are great places to find some of this info out. There's tons of Facebook groups for rat owners in various areas of the world, so use those to ask questions. Now, if you don't know too much about your rat's health, or rat health in general, you may not know if your vet is well versed in rat medicine or not. You may just trust their guidance without questioning it because you don't know any better, which is totally fair. That's why we're here and what this video is all about. We're here to help try to give you some tools to be able to tell if your rat is getting quality care or not, and how to increase the odds that they will be. This video is not at all intended to be bashing vets or be negative towards them in any way, shape, or form. We need them and they are awesome. But in our experience, sometimes vets don't know what they don't know and can be a little close-minded to treatment approaches in rats. It probably comes from the very little training that they get in school and the infrequent clinical exposure to rats. They can only learn based on what they see, and if they only see a couple rats per year with minor health concerns, then it's not huge depth of experience. For example, we recently had one of our trusted vets, actually, which is unfortunate, see a rat that got adopted from us recently who suddenly became paralyzed, and they immediately recommended euthanasia, saying his condition was a concern for his quality of life. I can see how at first glance that would be considered a reasonable assumption. Rats love to climb and run, and he can't do that anymore. But dogs and cats get paralyzed. They also love to climb and run, and they can still live completely full and enjoyable lives with adaptations. Rats are the same. I happen to actually have 2 paralyzed dogs and have had numerous rats with varying degrees of back-end paralysis. They all loved life, had flat cages for safety, scooted around, scavenging for and stashing snacks, cuddling, and doing the vast majority of rat things, except for climbing and running. They showed no signs of discomfort or depression, and there was no indication that their quality of life was poor in any way. We know our vet was just doing her best, but likely made that recommendation based on her experience with paralyzed rats, which was probably 0 or close to it. We would have hoped that she'd be able to present a more balanced assessment, discussing how his care needs would change, he'd need lots of enrichment to watch for signs of depression, etc., and then reassess things as needed. It's very sad to see a disabled animal, and it's easy for us to assume based on that visual that they're suffering. But just because they're disabled doesn't mean they're suffering. Another huge barrier that we've found is some areas of rat medicine just aren't explored a ton or very well known. Not everyone would choose to hospitalize their rat for pneumonia, so many vets think it's a death sentence because they don't get to see anything otherwise. They think that if a rat fails treatment with the standard enrofloxacin and doxycycline, that's it. It's just comfort care from then on. Even if they're open enough to suggest oxygen therapy, they think that once a rat goes on oxygen, they'll never come off. Euthanasia gets thrown around far too often, when in reality, pneumonia can be successfully treated more often than not if done promptly and aggressively. We and other rescues are lucky that we have the resources and access to be able to try things easily that aren't as accessible through vet clinics. We have oxygen generators, for example, so what would cost hundreds to thousands of dollars for a couple-day hospital stay at a specialty clinic to allow the rat with pneumonia a chance to recover, we can easily do in-house for free. Of course, we had to buy the generator, but they can also be easily rented with a vet's prescription, which is what we did until we were able to fundraise and purchase one. So we've been able to discover that the majority of rats do recover and actually often don't even have recurrences of pneumonia. Think about it if it were a human. If someone has pneumonia or another lung condition and needs oxygen to survive, we don't just throw in the towel. We leave them on oxygen until the antibiotics and steroids, etc., can do their job, and then they can come off of it and live the rest of their life. The same should be true in animals. Now, for some animals, obviously it makes sense that things like that aren't a very reasonable or feasible possibility because you can't get a cat or dog to sit still and comfortably leave an oxygen mask on their face as they live their daily life. But for rats, it's super easy. You just use a big, clear bin with holes in it to create an incubator, and you infiltrate the space with oxygen from the generator, from the tubing. Our incubator is the size of a critter nation, actually probably a little bit bigger, the size of a single critter nation. So they don't have to live in a tiny box. They live the same life with the same enrichment that they do in the outside world until they're better. Another common situation is hearing of people being presented with the reasoning that the side effects are too risky for a certain treatment. This happened recently with a pituitary tumor case where our adopter asked their vet to try bromocriptine, which is one of the 2 medications that's primarily used for those tumors and works very well. It's true, there are side effects, such as stroke, which are bad, but doing nothing also has side effects and is also bad. In this case, would mean imminent death. So the risk is well worth the benefits. We had to have a girl right now who could barely walk, and within 3 days of bromocriptine had 0 symptoms and has been that way for 6 months so far. That's a quarter of the expected rat life expectancy. And to rob the rat a possibility of a quarter of their life just because of a chance of some potentially serious side effects is just not cool. So we encourage you to think critically about the information that you're being presented from your vet team. I am very grateful that I have the knowledge and privilege of thinking about things this way and in this depth because I'm a doctor for humans. And I know some would judge that and, say that I perhaps do too much or go over the top for a rat, but I think it's a good thing and I don't think it's too much at all. I never allow the rats to suffer. Their safety and health and well-being is the absolute top priority and reason why I fight and advocate so hard for them in the first place. And I know I've helped a lot of rats, and so have others who have the same mindset. One last common thing that we hear about is rats with mammary tumors, benign mammary tumors, which most of them are, where the vet says that the surgery is not an option because they're 2 years old, or almost 2, or slightly more than 2. That to me is just kind of silly and not really an acceptable reason to deny surgery. Sure, rats' life expectancy is on average 2 to 3 years, but the difference between 2 and 3 is significant, and it can be more. We've had tons of rats live to 3, 4, and 1 to almost 5. But just because that's technically their life expectancy doesn't mean that that should be the only criteria that we base their operative risk on. In human medicine, we very rarely base a decision solely on the patient's age. It happens, but it's not common. You can have 2 people that are 80 years old, which is technically around the life expectancy for a human, but one of them can walk or ride bikes a couple kilometers a day, is healthy, doesn't look their age, cognitively intact with no significant medical conditions, whereas the other might be frail, malnourished, with dementia, and not a good surgical candidate because their risk of death or complications is very high. I think of rats the same way, and I don't know why some vets we seem to have encountered or heard about don't. If your 2-year-old rat is losing weight and their hair is thinning and they're not eating or drinking as much, not as mobile, not as energetic, and it's clear that they're kind of frail and on a decline, then obviously don't put them through the risk of surgery and let them live out their lives for as long as they can. But if your 2 or even 3-year-old rat is perfectly healthy, in very good physical condition, no medical issues, active, then there's no reason why they should be denied surgery for a benign condition that could save their life and prolong it quite a bit just because of a number, just because of their age. We've had many, and in fact, the majority of rats that we've had that have needed and undergone surgery have been over the age of 2. Because mammary tumors, for example, don't often even develop until the age of 18 months. So 2 to 3 years is kind of the prime window for developing those tumors. For those of you who follow us on social media, we shared on Instagram recently the story of Daisy, a 3-year-old girl who came to us with the most massive mammary tumor we have ever seen. It was bigger than her. It weighed more than her when it was removed. It was significantly impacting her mobility and would not have been fair to continue to allow her to live that way for much longer. But she was healthy and there were no signs of any other kind of medical condition, and she did not look like she was 3 years old. She was still full of life and deserved a chance to try to keep living it. She underwent surgery very successfully, recovered quickly, and is still doing fantastic 2 months later. So with these examples in mind, it's important to be prepared to ask questions, to do your own research, and to reach out to people who do have a lot of experience with rats, such as rescues, so that they can guide you in the right direction and help you know what to ask. Again, we are not veterinarians. I mean, some of us might be, but we are not necessarily veterinarians just because we run rescues. But we do see more rats in a couple months than vets will probably ever see in their entire career. We learn to recognize patterns and signs and symptoms, and for the most part, we know what conditions present like what, how they progress and how fast, what treatments work and which ones don't, based on a ton of direct experience. This is especially true for the more common conditions like respiratory disease, pituitary tumors, and mammary tumors. There's always still new uncommon things that we're seeing for the first time, but those three conditions make up probably at least 75 to 80% of the health issues in rats and reasons people take their rats to the vet. That and mites, which will probably be our next video. So when you're calling a vet to see if they'll see your rat or not, ask them how experienced they are and how often they actually see rats. Again, it's often helpful to find a trusted resource in your area who can hopefully direct you to vets that they've used and have been good. Make a habit of asking what all the possible causes for your rat's condition are, what all the possible treatments are. If they present you with only one option, I encourage you to seriously question that and push for more, because that's just never the case. There's always more than one option. If they don't present you with any, or they just don't know an answer, ask them if they can look it up or consult someone else who does know. There are veterinary databases where vets can look up questions and case examples and see what exotic specialists have commented. Even as a regular person, there's lots that you can find on regular internet searches, but far too often, many of us have found that vets just don't even bother to look things up and question the limits of their own knowledge. Perhaps it's a bit of speciesism from them as well, but who knows? So if you're not presented with any options or what you think are good ones, a good way to follow that up is by asking what they'd do if it were a cat or dog. It may not be transferable species to species because there are obviously differences, but the concepts are the same, and it might prompt them to think a little bit more deeply on the case at hand and if they're really doing their clinical diligence. Don't be afraid to ask them if they've seen this condition in rats before and how many times and how often. It's a clinician's duty to not practice outside their scope of knowledge and admit when they're not sure, don't have experience, or aren't the best person to be assessing this case. It is totally reasonable to say, I don't know, but I'll find out. Or I don't know, but let's look it up together. Or I don't know, but I'll refer you to somebody who will. We can't all know everything, and that's okay. But it's important for you and your animals to know that. Doctors and veterinarians are not perfect, and they don't know everything just because they are a doctor. It's okay to ask questions, to question recommendations, and to advocate for your pets as long as you do it in a respectful way. That being said, I encourage anyone who has questions about the rat's health to feel free to reach out to us anytime. The best way is through email because we get a lot of social media messages and it's easy for some of them to fall through the cracks. We're always happy to chat with you, help you identify the concern and what might be going on, make recommendations, and help support you through taking your rats to the vet. And I again want to be clear that the recommendations we are making are not us making medical decisions when we haven't physically seen the rats and are not licensed practitioners. What we do is share what we think may be going on based on the information you're able to provide and show us and our experience of seeing the same or similar things in rats in the past, and give you suggestions of what to ask your vet. It's totally reasonable for you to go to your vet and say something like, I've been consulting with a rat rescue. Based on their experience, this is what they think might be going on, and this is what they and their vet team do for this condition. What do you think? Nobody should take offense to that, and it shows that you care about your animal and want to do the best for them. We've had lots of cases where we've helped people in this way, and their rats have in turn gotten the treatment that they needed, and their vets got to learn something new in the process. So often we get messages from people saying things like, I took my rat to the vet for X, and my vet suggested this, but it's not helping, and they say there's nothing else to recommend. What do I do? And we very often find that the treatment options haven't fully been explored. So in this case, we can share with that person that what our vets have done in similar cases and encourage them to go back and ask their vet if they can try it. Odds are that that'll prompt them to look it up, see that it is a possible next step, and work with you. We've rarely encountered people who have said that their vets ignored or declined a reasonable management suggestion. Many of them are open to learning new things, and the questions that you ask and info that you bring to your appointments can help them learn. So before I wrap up, again, want to be clear, we're not at all saying that vets are the bad guys. If anything I've said or the way that I've said it in this video has given that impression, I apologize and want to make it clear that that is not at all my intention nor my opinion. It's a touchy subject, so I've tried to do my best to be neutral and non-judgmental and choose my words wisely at the same time as sharing an honest recount of our experiences, but I'm not perfect, and I think it's really important that people know about the limitations of rat vets and have the tools to best help their pets. So I'm okay if some people don't love this video and find it a bit controversial, because if it helps even one person get better care for their rat, then it's worth it. Thanks for taking the time to watch our video. Hope you found it helpful in some way. In the description below, I've included some examples of questions or discussion topics or ways that you can ask certain things when you go to your vet. So hopefully that will be helpful to some of you. Again, reach out to us anytime if you have any questions. Subscribe, follow us on Instagram, and thanks for supporting us.